Okay, let's get straight to it. You've shared some solid revision notes on infrapatellar bursitis, sometimes called clergyman's knee or housemaid's knee.
That's right.
We're going to drill down into exactly what you need to pull out from these notes for revision. Basically, make it stick.
Absolutely. So infrapatellar bursitis, what is it? Simply put, it's inflammation of the bursa that's a little fluid-filled cushion that sits just below your kneecap, the patella.
Right, the infrapatellar one, not the prepatellar one.
Precisely. And its job is to reduce friction during knee movement. So when it gets inflamed, you get that pain and swelling typically right at the front of the knee, just under the kneecap.
And those old names, clergyman's knee, housemaid's knee, they kind of give the game away about the cause, don't they?
They really do. The etiology, the cause, often comes down to repetitive kneeling or, a direct blow to the knee. That's the main mechanical stuff.
But it's not always just mechanical, is it?
No, that's a key point. You've got to remember infection that's septic bursitis or sometimes underlying inflammatory conditions like gout or rheumatoid arthritis can trigger too.
Okay. So overuse, direct hit, but keep infection and inflammation on the radar. Got it.
hmm
Who's most likely to get this then? The risk factors.
Well, as the name suggests, anyone doing jobs or hobbies involving a lot of kneeling, think gardeners, carpet layers, plumbers.
Makes sense.
Also, direct trauma, maybe from sports, bumps up the risk. And interestingly, people with a compromised immune system might be a bit more susceptible to the septic, the infection-related kind.
Right. So pathologically, what's actually going on inside the knee there?
So, the pathophysiology.
Mm.
Basically, that repetitive kneeling or the direct knock causes irritation or microtrauma to the bursa. This kicks off an inflammatory response.
Standard inflammation process.
Exactly. Fluid builds up, the bursa swells, and that causes the pain and the visible swelling. If it's septic, then bacteria have managed to get into the bursa somehow and set up an infection, leading to inflammation that way.
Okay. And knee pain. It can be tricky. What else might look like this? The differential diagnosis.
Yes, super important to differentiate. You've got things like patellar tendonitis, that's the tendon itself, patellofemoral pain syndrome, which is more general pain around the kneecap,
Mm-hmm.
and importantly, prepatellar bursitis, remember that's inflammation of the bursa in front of the kneecap. Ours infrapatellar, below. Even knee osteoarthritis needs to be considered sometimes.
Location, location, location. Infra means below. Got it. How common are we talking here? Epidemiology.
The notes say it's common in the UK, particularly, unsurprisingly, in people whose work or hobbies involve that repetitive kneeling. So, yeah, you'll likely see it.
And what are the classic signs? How does it actually present clinically?
Key features are that localized pain and swelling, specifically below the patella. The pain usually gets worse with activities like bending the knee, climbing stairs, or, of course, kneeling.
Right.
And if you examine it, the area over that bursa will be tender to touch. You might actually see the swelling, or at least feel it, like a little boggy area.
Okay. So history and exam point towards it. What about investigations to confirm?
Often it's a clinical diagnosis, but imaging like X-rays or maybe an MRI can be useful, mostly to rule out other things like fractures or tendon issues.
Makes sense.
But if you suspect septic bursitis, maybe the area is very red, hot, or the person seems unwell, then aspirating fluid from the bursa is crucial. Sending that fluid off for analysis tells you if infection is present.
Right. That's key for septic. And management. What do we do about it?
Management in the UK typically starts conservative. That means rest, avoiding the activities that aggravate it, using ice packs to reduce swelling.
The simple stuff first.
Exactly. Over-the-counter anti-inflammatories like ibuprofen can help with pain and inflammation. Sometimes physical therapy is useful too for stretching and strengthening.
And if it is septic?
Well then antibiotics are absolutely necessary. You need to treat that infection promptly. Surgery is rarely needed, really only considered for very persistent cases or recurrent problems that don't respond to other treatments.
Okay. And the outlook. What's the prognosis, and are there any nasty complications to watch for?
Generally, the prognosis is good. Most cases resolve quite well, often within a few weeks, especially with that conservative management and avoiding the cause.
That's good news.
Yeah, but complications can happen. Things like persistent pain, maybe some limitation in knee movement if it becomes chronic. And the big one, obviously, is septic bursitis, if an infection isn't caught and treated quickly. That can be serious.
So timely management is key. Is there a mnemonic or anything?
Well, you can think B-RICE for bursitis management. It's a bit adapted, but bursitis rest, ice, compression, implied for swelling control, elevation, also helps swelling, and maybe add N for NSAIDs. and just keep hammering that location. Infrapatellar, below the plate.
BRC plus NSAIDs below the plate. Got it.
So, thinking about your revision,
Mm.
hopefully this has helped cement those key points. Remember the common names linking to the cause, the different potential triggers, especially infection, and the importance of location for diagnosis.
Definitely helpful. What do you think is the absolute must-remember point from all this?
For me, it's probably distinguishing it from prepatellar bursitis based on location, and always considering septic bursitis if the picture looks infectious. Missing that is bad news.
Good point. It raises that question, doesn't it? How crucial is really knowing that detailed knee anatomy to tell apart all these different bursitis types and tendinopathies? Something to mull over.
Definitely food for thought as you study. And listen, if you need more resources or want to test yourself with practice questions for the MSRA, do check out pastthemsra.com.
Yeah, and there are some great free materials too over at framesra.com. Keep up the excellent work.